The last time somebody filmed for AP Bio, they just had me and none of the screen.
Yeah.
And I was pointing to the screen the whole time.
I got the screen on.
So it's basically...
It's like perfect too, look.
Yeah, got it.
Dow approves. Oh,
okay, this is page 169. Acromegaly. Abnormal enlargement of facial features, hands, and feet in
That's
adults
why his face looks so
as a result of overproduction of growth hormone. That guy's got too much growth hormone. That's the tallest man that ever lived. His name's Robert Wadlow.
He died because
he's dead, yeah.
His shoes.
He died.
He was a shoe salesman. When he died, he was 7'11".
How you doing? Ew. Forever caught on film.
Ankylosis, abnormal stiffness of a joint or fusion of bones at a joint, often due to damage at the joint membranes from chronic rheumatoid arthritis. See, the bone has grown together, so now he can't bend that knee.
So, like, in order to bend the knee, he'd have to break.
You have to break the bone, which you can't do. You're not even strong enough to do that.
So is that like, would that be the femur?
Could you saw it?
Or the...
That's the femur, that's the tibia, that's the fibula.
Did they saw it? And it would be okay. What happened to the cartilage?
It grew and changed into bone.
Yeah.
What causes that to happen?
It's usually due to chronic rheumatoid arthritis or some other sorts of damage to the membranes of the bone. Rheumatoid arthritis is a type of arthritis, of swelling of the joint. Arthralgia, that's just the general term for pain in the joint. Arthralgia. I have arthralgia right now from that game last night. Arthrocentesis, puncture of and removal of fluid from a joint cavity. Sometimes the joint gets so swelled up you got to remove some of the fluid. Sometimes you're testing the fluid to see if it's infected. There's all sorts of different reasons for going in there. Arthrodesis, surgery to fuse the bones at a joint. So here they've put in screws to screw together some of these tarsals. For some reason, I don't know why they would do that for this person, but he probably had some foot problem. The metal shows up really well on x-rays. Arthroplasty, surgery to make a joint more movable. So this person probably had some joint problems, so they put in a metal ball and socket there. That's called an arthroplasty. Colles fracture. Fracture at the distal end of the radius that displaces the smaller fragment posteriorly. This is a common fracture that people get from falling and catching themselves. That's what this guy's doing. That's not a real person, by the way. That's a drawing.
Oh.
But if you fall and catch yourself, sometimes you get this fracture. That's the radius bone, and there it's broken at the end there, you see? That's called the Colles fracture.
Doesn't have an elbow. Doesn't need
one. Epiphysiolysis. Separation or loosening of the epiphysis from the diaphysis of a bone. Epiphysiolysis. Remember, the epiphysis is the wide end and the diaphysis is the thinner end. So they've broken apart there. Hemarthrosis, blood in a joint cavity. There's a bunch of blood in there, some bleeding has occurred. Not sure why. There's blood vessels that go around the area, so they were broken somehow.
What would that cause?
I don't know.
I mean, is like the blood...
Extra
like
pressure? I don't know. That's a good question. Probably not good. Laminectomy. Surgical removal of the posterior arch of a vertebra, usually to relieve the symptoms of a ruptured intervertebral disc. You remember the lamina is a part of the vertebrae? And you cut the lamina and you take out the bone, so this bulging disc, to relieve pressure, when an intervertebral disc bulges and pushes out on the spinal cord, it can pinch it so hard that you start to lose nerve function. So if they cut off the back here, you're doing a laminectomy, they can pull these pieces off and relieve the pressure. Have you ever heard of a bulging disc or a slipped disc? It's when the intervertebral disc slips, pushes toward the spinal cord. Not good. Lumbago, dull ache in the lumbar region of the back. Lumbago. That guy had it. Orthopedics, medical specialty that prevents diagnosis and treats diseases and abnormalities of the skeletal and muscular system.
He has 8 teeth.
Like an orthopedic surgeon. You've heard of him?
Ooh, that looks bad.
Ostealgia, pain in a bone. Anytime you see algia, that's pain. Ostealgia means pain in a bone because osteo means bone.
Ooh.
Osteectomy, surgical removal of a bone. Anytime you see ectomy, that means they're taking it out.
Why they do that?
Tonsillectomy, have you ever heard of that? Taking out the tonsils. Osteectomy, taking out a bone. Osteitis, inflammation of bone tissue. Anytime you see itis, that's inflammation.
Oh, pus in the joint. Ugh.
Once you know the roots and such, you can guess what it is. You know, osteo means bone. You know, itis means swelling or infection. Osteochondritis, inflammation of bone and cartilage tissues. Itis means inflammation, osteo means bone, chond, C-H-O-N-D, means cartilage. So somehow you got information of the bone and the cartilage. Osteogenesis, bone development. They have this picture on bone development in your book showing how the bone develops over time. That's called osteogenesis. Osteogenesis imperfecta, inherited condition of deformed and abnormally brittle bones.
Oh, he's naked.
Some people's bones just break really easily. They don't form correctly. An osteoma, tumor composed of bone tissue. That's a big bone tumor. And here you see a bone tumor in somebody's vertebra. Pretty gross, huh? Yes. Osteomalacia, softening of adult bone due to a disorder in calcium and phosphorus metabolism, usually caused by vitamin D deficiencies. There's a normal bone, and there's a vitamin D deficient bone. Osteomalacia. It's also called rickets. Have you ever heard of that? Kind of a common name for that, rickets.
Can you be fixed?
I don't know if it can be fixed because bones take a long time to repair themselves. But you know, you could cut this whole part off and replace it with metal. You could take vitamin D supplements and make sure you get plenty of vitamin D. That's usually what they do to someone with rickets. They make sure they get plenty of vitamin D, and over time it will slowly heal. But there's probably some damage that can't be healed.
Can you get rid of the bone tumor the same way you would regular cancer? Or regular tumor?
Yeah, you can cut it out if it's just not spreading, and you can do radiation treatments and all that. You have to kill the bone cells. Osteomyelitis, bone inflammation caused by the body's reaction to a bacterial or fungal infection.
In your bed.
Osteomyelitis. Osteonecrosis, death of bone tissue. This condition occurs most commonly in the femur head in elderly persons and may be due to obstructed arteries supplying the bone. So the bone starts to die, and so you get hip pain and hip problems. All these old people have all sorts of hip problems. There's a lot of weight, you see, that goes onto the head of the femur here, and often that'll break. You ever heard of someone with a broken hip? That's usually where it breaks, right there. And it usually happens when they're getting into the shower, because they step over the bathtub, and they step this way, and they're putting all their weight on one leg, on one head of the femur there, and it just breaks. And so you'll hear of an old person, who broke their hip in the shower. That's usually what they mean. Getting into the shower, getting out of the shower. Nowadays they make these new where you can open and not have to step over. Have y'all seen those? Mm-hmm. And that's probably a good idea when you get old, to have something like that so you don't have to step over and put all your weight on one.
Did you see his demonstration?
Osteopathology.
I don't believe you.
The study of bone diseases. Osteotomy, cutting of a bone. They cut out a little wedge of the tibia here. I don't know why, to relieve pressure or something. Osteotomy. Synovectomy, surgical removal of the synovial membrane of a joint. Some people's synovial membrane gets inflamed and such, and you have to take it out.
How would you take it out? Why wouldn't you need it?
I don't know. Probably lose some function, but it might be better than having a inflamed synovial tissue. What's that?
Was it like a knee replacement or?
No, that's not a knee replacement. I don't have a good picture of a knee replacement here. I don't think. Anyway, I wanted to show you this last video. You ever heard about the guy with 3 legs?
I have now.
Or he's got an extra foot is what he has.
Oh, yeah.
I missed it. Where is it? Where's the foot? There it is. Here's a guy with the extra foot. It's an amazing medical story.
In Arcadia, California, the Santa Anita racetrack is where Jose Lopez makes his living as a horse walker. A necessary piece of equipment for anyone in Jose's line of work would be a comfortable pair of Western-style boots. But for Jose, that was impossible. Jose was born with a 3rd foot, almost fully formed and growing out of his left ankle, a condition previously unheard of in modern medical chronicles.
I was born this way, and it's all I knew. So I just tried to do everything as normal as anybody else. I had to use a swinging type of walk in order to protect the feet from hitting each other, because the 3rd foot was pointed to the other side, right in between the two.
As a young child in Mexico, Jose's doctors offered little hope.
I'm not sure that the doctor who first saw me in Mexico was a specialist in that area, because he told me that he was not sure how the operation would come out. He even said I might be handicapped after the operation.
Eventually, Jose moved to America and took a job at the track, all the while hiding his deformity under baggy pants.
One morning, one of the horse owners at the stable I used to work for told me that help was available if I wanted it.
Jose's benefactor arranged for an examination by a team of foot and ankle specialists at the Whittier Medical Center near Los Angeles.
At first I thought he was putting me on a little bit, or embellishing some anatomy there, but when Jose first came into the office and I saw it for myself, I was a believer.
So it was hard to believe when you actually see something like that it's real. I mean, it was really kind of like it just didn't even look real.
Almost 6 inches in length, Jose's third foot was large enough to wear a size 4 men's shoe. It had 4 fully formed toes with toenails.
This foot was highly developed and had all the sensation and vibration and all the sensitive touch that we feel in our hands and toes. So
these were the first x-rays taken in the office back in February. Here is the existing left foot, a normal structure, normal bone density, and here is the extra foot. We have a heel bone, fused ankle bone, mid-tarsal area, 4 functional metatarsals of full length, and 4 toes. I was even more surprised to see that was all a soft tissue union, and at that time I thought it would be pretty easy to remove it.
The doctors scoured medical databases for information on Jose's unique affliction. They found numerous cases of extra fingers or toes, but never uncovered a single mention of an extra foot. Their conclusion? That Jose's foot was a rare genetic anomaly. Both doctors agreed to donate their services to have it removed. The foot was attached to Jose's left ankle by tissue, muscle, 1 nerve, and 1 artery. Fortunately, there was no connecting bone, and the extra foot's Achilles tendon was isolated from the one on his normal foot. This scenario could not have been better for the procedure.
After the incision, we go down to the deep fascia, try to identify any structures that can be identified.
During the operation, the only artery feeding the third foot is isolated and tied off. Dr. O'Shea severs the connective tissue, including the third foot's Achilles tendon. The extra foot is removed as one whole piece.
We take our redundant skin from the extra foot, close first the deep fascia, repair the Achilles tendon, and close the skin.
The deformity that Jose had to live with for 33 years is removed in just under an hour's time.
one of the last times we saw Jose, he was ecstatic that he had full function of his leg back, not having to swing around the third extremity.
It's been such a short time since the operation that sometimes I can still feel it, as if it is still there. And I do feel for it, just to remember how good it feels to have had the operation.
One of the first things Jose does after he recovers is to fulfill a modest lifelong goal. Now Jose can take on life on his own 2 feet.
Woo! Amazing. All right. Do an ID if you hadn't done